Hi there. I'm Dr. Richard Grossberg. I'm the medical director at Hattie Larlham, and I wanted to take this opportunity to talk to you a little bit about the coronavirus and the vaccine that is now available to us. The virus has taken an enormous toll, really, on all of us. I can't imagine there's anybody listening to this who doesn't know somebody or hasn't been personally impacted by this virus. It has really turned the entire world upside down and sown a tremendous amount of fear and uncertainty. It's also been tremendously difficult for our residents in our care who've had to deal with social isolation, lack of integration into programs in the community, and many of them may not have the capacity to even understand why. So this has been enormously difficult for them as well. And then I want to speak specifically to our staff, because the people who work at Hattie Larlham come here really out of a sense of mission and purpose. This is not a place where people work to get wealthy. It's a place where people come to work to really love people, and particularly to love people who can't help themselves. That's a worthy vocation, in my opinion. But in the midst of a pandemic, to come to work where you can get sick, where coming to work means you can risk your own health and the health of your loved ones, this is the stuff that we're talking about of what makes a hero. We talk a lot about frontline healthcare workers, who I truly believe are worthy of praise. But I really want to add those who work in nursing homes, in group homes, at all levels: nurses, people in cleaning services, transportation, therapists, direct care workers, respiratory therapists, speech therapists, you name it. These are people who are true heroes, who are really risking their own health and bringing this home to their family and loved ones. So my sincere praise and admiration and thank you goes out to all of you from the bottom of my heart. Let me just talk a little bit about how we've handled coronavirus so far at Hattie Larlham, which I think has been successful, thanks to the staff largely that I've just mentioned, but also to talk the potential impact of coronavirus on our residents. I'm very proud at the main campus that we've had staff who've had coronavirus. We've not had one of our residents infected. I think given the size of the facility and many of the measures that we've taken place, we've actually created a bit of a bubble here that's lent to that outcome. However, for many of our other locations in Northeast Ohio and Central Ohio, which are more integrated in the community, this has been a little bit more of a challenge, and we've seen some more illness in both residents and staff. However, I'm happy to report that there have been no deaths and no serious outcomes from coronavirus in any of our locations. I think this is due to the hard work of our staff, the measures that we've put in place, and a bit of luck. And hopefully, now that we have these vaccines and this pandemic will hopefully come to an end, we can keep that going, is certainly my hope and expectation, and we will work hard to do that. That said, let's dig a little bit more into the actual coronavirus and the vaccine. Hopefully by now I don't have to spend much time explaining what coronavirus is and how it does its damage. We have been dealing with coronaviruses for decades, but this was a novel coronavirus that came about at the end of 2019 and has really spread globally around the world. It is more contagious than the flu, and it's certainly done more damage than the flu, as people I think are well aware at this point. It is largely spread by respiratory droplets, and the damage that it does is mostly when people get severe pneumonia. How can we prevent this? Many of the measures we already have in place have served us well, and we will continue to do those. But the true light at the end of the tunnel is the vaccine. Let me explain to you the vaccine that is available to us. Many of our locations have already started with vaccination. The vaccination is not mandatory. We are recommending it, and I'm hoping by explaining it more to you folks today that will increase the rate of people who choose to get it. But we are already in certain locations beginning to vaccinate staff as well as our residents, and we will see this roll out further in all of the locations in Northeast Ohio and Central Ohio over the next several weeks and months. The product that we are using has been developed by Pfizer. It is similar to the Moderna vaccine that is also available. This works by a novel technology called mRNA, which I'm going to talk to you a little bit more about. The vaccine, the Pfizer vaccine, is approved for people 16 and older, and the Moderna vaccine is approved for those 18 and older. Both require 2 vaccination shots for it to be effective. With the first vaccine, about 50% of people will make enough antibodies that they're protected, but with the second vaccine, it will get us to 95% of people will be protected if make enough antibodies. That still means, though, that about 5%, may not be protected. So careful measures with limiting visitations and restrictions will likely still need to be in place, as well as mask wearing, until we get enough people vaccinated and the number of cases start to drop, which hopefully will happen. The Pfizer vaccine, the second dose is given 3 weeks after the first dose, and if anyone ends up getting the Moderna vaccine, the second vaccine is giving it 4 weeks. There really is no reason not to get the vaccine. They say in terms of allergies, they say that if you're allergic to any component in the vaccine, you shouldn't take it. But these are very rare and unheard of substances that people may not know that they have an allergy to. So the recommendations are largely not going to prohibit most people from getting the vaccine besides age. Like I said, the age 16 and above for Pfizer, and 18 and above for Moderna. If you do have a history of some severe allergies, particular allergies that can lead to anaphylaxis, I recommend you have a conversation with your physician. The recommendation is likely to still proceed with vaccination and then to be monitored. Everyone will be monitored for at least 15 minutes after vaccination. There have been some very rare reports of anaphylaxis, which is a severe allergic reaction that could lead to swelling and difficulty breathing after the vaccination. This will largely happen within 15 minutes and is reversible by medications that will be available at all the vaccination sites. However, if you have a history of severe allergy or anaphylaxis, you'll be watched for a little longer period of time, and it is much more likely that you would not get a reaction than you would for certain, but you would be watched for, instead of 15 minutes, 30 minutes. Pregnancy is not a reason to not be vaccinated. It has been approved by the FDA for pregnant women. And there are lots of misinformation, I think, out on the internet and other sources about the vaccine promoting infertility, but this has not been recognized by the CDC or the FDA. So I do not think that that is a legitimate concern at this point. Let me talk a little bit more specifically about how the vaccine works and talk about some reservations that I think everyone should have thinking about whether to give the vaccine. But I do think at the end of the day, when you look at the risks versus the benefits really overwhelm the risks. So how does this vaccine work? The vaccine is administered in the arm. It gives you this mRNA that is covered in a bit of a fatty profile that enables it to enter the muscle cells in your arm. Once that mRNA enters your muscle cells, the mRNA, the best way to think about it is it's almost like a cookbook. And it gets into the cells and it takes over the machinery inside of your muscle cells that are sort of like a kitchen. And the cookbook tells all the kitchen appliances within your cell to manufacture a protein. And the protein that you will start to manufacture is that spike protein. It's that little red spike that those of you who have seen these pictorials of the coronavirus on TV see sitting on the outside of the virus. Once your body makes that protein, the protein leaves your muscle cells, gets outside of your muscle cells into your bloodstream, where your immune system will then respond to that spike protein and make antibodies that your body would use should it actually get coronavirus to fight it off. This is a newer technique for vaccines. Older vaccines, which by the way took longer to manufacture, this new technology is not a shortcut. This is really well-established science that has been used more recently to develop other vaccines as well as cancer therapeutics. But this was an opportunity with the pandemic for researchers around the world to really push forward this technology in a faster way. The new science allowed this to be manufactured much faster, not a shortcut, so that we can sort of trick the body into manufacturing this protein that we can respond to and build immunity to, rather than the more traditional pathway, which takes longer to make. And that's why some of these more traditional vaccines are not available yet. The more traditional way of doing this would be to create a vaccine that has the spike protein without your body making it. That's the more traditional route. And then when you administer that vaccine, your body would build immunity. Those vaccines will become available, but they take a little longer to make, and that's why they're not quite ready just yet. Because this technology is newer, there could be questions about, well, what are the long-term effects of mass immunization using this new way of creating the spike protein? I think that's a legitimate question. But I think we know from tens of thousands of administrations in the studies that, number one, this is highly effective. The vaccine really prevents you from getting coronavirus and making the immunity you need to make. We don't know, though, when we give a vaccine like this to millions of people, could there be some side effects that we didn't recognize in the studies when we gave it tens of thousands of people? That's possible. I think it is less likely to be concerning as we move forward, but it is an unknown, and I want to be transparent with you about that. I think the risk of getting coronavirus and the chances that you may have a bad outcome from the coronavirus are greater than any likelihood at this point of this vaccine causing a severe side effect. So that's again where I say I think the risks are much lower than the benefits of getting this vaccine. The other issue that we will have to monitor is how long will you have immunity after you get the vaccine? Right now, if somebody gets coronavirus infection, we believe they're safe from reinfection for about 3 months, but we don't know yet how long the immunity will last. That will be a similar question for the vaccine, and that will be monitored over time. Will it last for a year? Will it last for a lifetime? Will you need another booster shot, maybe every year, like we get the flu shot every year? These will be followed, and we will know that information over time. So I don't think that's a reason not to get the vaccine, but it's something that we need to think about, and that will be monitored over time. So now that you understand a little bit about some potential concerns about the vaccine, but how the vaccine was manufactured, how it got to market so quickly, how efficacious it is, how safe it is, I want to talk a little bit about potential side effects. And then I want to reassure people about certain myths versus facts about the vaccine, so you could feel more comfortable making your decision, so that you make your decision, based on factual information. First of all, you cannot get coronavirus from the vaccine. That is absolutely 100% impossible. The entire virus is in a live form is not even part of any vaccine that's being manufactured. You are only being given a either small part of the virus that is not alive and cannot replicate in your body, or, like I said, a piece of a cookbook or RNA. There are even going to be DNA vaccines that will make your cells make a piece of the virus that your body can respond to with immunity. It is not giving you the actual virus. So it is impossible to get coronavirus infection from the vaccine, and it is impossible to test positive for coronavirus just by getting the vaccine. That said, there are some side effects, and the side effects seem to be more frequent than what we see with a typical flu vaccine. The good news is they are mild side effects, and they tend to go away after around 2 to 3 days. What are those? They are soreness in your arm and a little bit of swelling in your arm. The reason is, when I explain to you how this vaccine works, when your muscle cells are revving up to make that protein, that leads to a little bit of inflammation and pain in your arm. That is, in most cases, generally very mild and will, like I said, go away after 2 to 3 days. There are also, in some cases, people may feel some fatigue, they may get low-grade fever, they may have some chills. But again, this is not secondary to getting infected with coronavirus. That would be impossible. It's your body's immune response responding to just this spike protein. Those symptoms, again, are generally mild and will go away in 2 to 3 days. Some of the studies have shown that with a second vaccine that you may be more likely to get some of these side effects, but again, they will go away generally in a couple of days. The next question is, when are you presumed to be immune after getting vaccinated? After the first dose, it would take approximately 2 weeks for about half of the individuals to have a decent amount of immunity. And after the second vaccine, it will take another 2 weeks for likely 95% of those who receive it to have responded. So it really will take about a month and a half after the first vaccine for us to say that you are likely protected. However, I want to be very clear that until we get much further along in the pandemic, we will still need to practice wearing personal protective equipment and masking and social distancing until we get this better under control. I would end this by saying, I had to personally make a decision about whether to take the vaccine. I am on faculty at Rainbow Babies and Children's Hospital, which is part of University Hospitals of Cleveland. And when I'm not at Hattie Larlham, I spend my time there. Through my employment there, I had the opportunity to take the Moderna vaccine a couple of weeks ago. And largely based on what I've just shared with you today, my personal decision making was that the benefits of this vaccine far outweigh any risks. I did have some soreness and swelling in my arm. I did feel a little bit tired, and that all resolved within 2 to 3 days. So I don't normally share my own personal story or my own personal feelings about what to do with medical decisions. I'd much rather be an informant for you, but in this particular situation, I thought it was helpful for me to share my own personal decision making. Lastly, I would just like to say that making this decision, I know, is difficult, and I hope I've given you some factual information to aid in your decision making. But I want to add, while I don't think this should be the basis of one's decision, I really want to emphasize that the only way we as a society will get a handle on this pandemic is by the majority of us getting immunized. I appreciate your time. I hope this went a long way to answer many of your questions and your concerns. And again, I want to thank you for your patience, for your tolerance during this difficult time. And I really want to thank our staff for their incredible effort during, I think, one of the most challenging times in our history. We have done well, and I hope with increasing our rates of immunizations, we will all get through this and put an end to this challenging time. Thank you.